Hey everybody! It is once again that time in the semester where we discuss the pillars of West Virginia University at Parkersburg's Baccalaureate Nursing Program. This semester we're going to be discussing patient-centeredness, so let's jump into that topic a bit. So patient-centered care is one of the 6 domains of healthcare quality that have been identified by the Institute of Medicine. These 6 domains, which include safety, effectiveness, timeliness, efficiency, equitability, and of course patient-centeredness, are meant to encompass what quality healthcare should be. They also give the general population a comprehensible framework in order to allow them to better understand quality measures as they relate to patient care. With this aim in mind, it's easy to imagine that patient-centeredness is maybe not only just the most important of the 6 domains, but perhaps the overarching domain as a whole that drives the others. But to talk about that, we really kind of have to define what patient-centeredness is at first, so let's do that. According to the Agency for Healthcare Research and Quality, exhibiting patient-centeredness means that healthcare professionals should provide care that is respectful of and responsive to individual patient preferences, needs, and values. The expressed goal of patient-centered care is that the values of the patient should guide all of the clinical decisions. This focus on the patient experience exemplifies empathy, compassion, respect, and responsiveness to each individual patient. Patient-centered care also allows the patient to take a more active and hands-on approach to their own treatment. Increased self-involvement in care directly correlates to better medication adherence, more kept follow-up appointments, and an increase in healthcare utilization by community members. Of course, that turns into better healthcare outcomes as a whole as we look at things on a macro scale. All of this, reads real nice and sounds very pretty, but what does it actually mean when we're looking at practice in the everyday? So this requires a collaborative approach across specialties and roles where individualized comprehensive care plans are developed. But with those care plans, we're looking at more than just one individual problem. We're looking at the patient's ailments at the time, their mental health, their social needs, what they're going to need when they get home. This is holistic care, and this is also patient-centered care. This means that the treatment plans at every level focuses on the patient and their experience and what's going to happen to them in that moment with their ailment and how we're going to help them in that capacity. This information should shape the care plan from the moment they walk into the hospital to the moment they leave. For nurses, for us, that means that we should act not only on diagnostic information such as lab values, but we should also make a concerted effort to assess the patient emotionally and spiritually as well. Doing this requires physical interaction, of course, and conversation. And it might be something as simple as just writing the preferred nickname for a patient on their board so that other staff members will call the name they prefer. It's little things like that that really focus on the patient and their experience, again, being patient-centered. This might also mean pushing back against orders that are antithetical to a patient's desires, even if they are the orders that will be best. The easiest thing that comes to mind is, of course, the Jehovah's Witnesses with blood products and whatnot. But that can look a lot of ways, but ultimately it just comes back down to focusing more on the patient than most other aspects of how our job works. So there are also a wide variety of frameworks and methodologies that have been identified to improve upon or increase patient-centeredness of a given facility or specialty. And all those same frameworks sort of share the same end goal, and that is to increase the patient's physical well-being, social well-being as well, and their overall satisfaction with care. Though the methodologies may differ, the myriad benefits of increasingly including individuals in their own care is irrefutable. As healthcare professionals, we should expect that this trend should not only increase in popularity, but should really grow to be the standard moving forward, in the next couple of generations. So I think that pretty much covers everything that we need to, or that I feel like I want to discuss with patient-centered care. We talked about what patient-centered care is, how the idea relates to nursing and healthcare as a whole, the benefits that are possible with patient-centered approach to everyone's care, and then we've identified what this type of care might look like in practice. Thanks for taking the time to watch this, and I look forward to seeing what everybody else has to say. See y'all later.